Hi, it's Kathy Kress again, and I am back with my YouTube channel, Geriatric Care 1, and we are doing Caregiver Assessment. And we are actually in the 9th segment of the playlist, Caregiver Assessment. So we are talking about already, and you can go back to number 8 or 7, how to do a Caregiver Assessment, and what do you do? So you're assessing many things, and you're assessing physical health. And the easiest thing to do is really just ask a caregiver, how is your health? It's a really, really accurate read. And they'll tell you it's poor, it's good, it's excellent. And if you need to, if they, you feel like they need to really have their functional health checked out, then you can, suggest they go to a doctor. You're not a doctor. So you do that, and then you're back to measuring caregiver burden. And I already talked about that, but you're measuring what do they do that's putting them over the edge. And one is IADLs, and that's in Mrs. Handy's case. She's answering the phone, she's writing checks. Her father can't do any of that. IADLs, Mr. Wilson. But Mr. Wilson also has ADL problems she's taking care of, which goes back to the burden. And part of that is that he's not sleeping, and he won't allow her to change his diaper, which is an activity of daily living, and so she's not sleeping. But you have to also compare, in a physical sense, the caregiver duties and the caregiver functional tasks and their ability to do it. So for instance, if you have an older person who has macular degeneration and they have to give their husband injections because the husband just got out of the hospital or has diabetes, they can't see. So in that case, in a caregiver assessment, you're going to recommend probably that they get a private caregiver or a daughter to do it. So you have to look for things like that. Can they lift? I can't lift anymore. And lifting is a really specific skill. And then you're looking at psychosocial assessment parts. And, if it's an older caregiver, sometimes they have memory loss. And so should they be taking care of their husband if they can't remember to give the right meds? Caregivers can have cognitive problems. They can also have behavior problems. Lots of times you find caregivers who are embezzling money from the older person. You find caregivers who are abusive physically. Behavior problems are rife in caregivers, mostly because of caregiver stress. And then you want to look at the demographic information, and that's just basically, who are all the family members, and then you want to look at the whole family. Who can help them besides paid caregivers if they can't afford that. And in Mrs. Handy's case, we talked about her last time. Mrs. Handy is a caregiver, and she's the oldest daughter, thought she could do it all. She had to do it all, and therefore she couldn't get the help of her family. And she had 4 siblings, and so what the geriatric care manager suggested was a family meeting to share the care. And the last thing you really want to look at is what tasks are onerous. And by this I mean, what just you can't do. I could not change my father's diapers. I couldn't change my kids' Band-Aids. I'm not a nurse. Oozy stuff I did change my kids' diapers. That was nothing. But sometimes caregivers find tasks onerous, and we try to shove that under the table because we should do it all. You don't have to do what you really hate doing. And so you want to pick up those things in a caregiver assessment. I'll see you next time, kathykress.com, and always go to my blog. Thank you.